Good afternoon, everyone, and thank you so much for joining our webinar today, Regulation GPS, Rerouting Health and Welfare Plans. My name is Amanda, and I'll be your moderator today, and ERISA attorney Larry Grugin is our presenter. This is an issue that I know we've been seeing a lot of questions on. We always have a lot of information packed into these legislative update webinars, so don't worry if you missed something. We'll be emailing you a recording and the slides after the webinar concludes. I'll be keeping the webinar muted to avoid any background noise, but Larry will pause periodically for questions. Just type your question in the box below, and I'll read it aloud for you. Our next webinar will be on May 16th at 1 p.m. Central, and we'll be covering Medicare for employers. For now, I'm going to turn the presentation over to Larry.
Thank you, Amanda. I appreciate it. Normally, every 6 months, I have a seminar updating what's happened with the IRS, DOL, and other governmental agencies. This time, it's slightly different. Ever since January in the Trump administration, there has not been that much being released by the agencies. And what everybody's interested in is what's happening with healthcare reform. It's in the news this week. It's been in the news over the last month. And what I'm going to try to do today is give you an update on what's happening with healthcare reform and let you know what may be happening over the next few weeks and months. So there's no political spin here. I'm trying to let you know what's happening. I will cover in this presentation these three areas: the current state of ACA, what's been happening over the past couple months on the repeal of ACA and Trump Care, and then put my crystal ball on and trying to let you know what could happen in the future. And the current discussion on healthcare reform is heating up right now, and right now the Republicans are short votes. So we should know over the next few days whether the second version of the ACA repeal will go through. Now, after this presentation, I think you're going to have a better feel for why the Republicans are having a tough time repealing and replacing Obamacare. Because I'm going to go through about the pros and cons of Obamacare, and I think you'll see why this has been so difficult over the past few months. So let's get started on this. First of all, I'll look at the current state of ACA, where it's at, the pros and cons of the Affordable Care Act. And this discussion is what was the current state of healthcare in 2009. And looking at the slide, you'll get a better picture of what healthcare looked like in 2009. The green is individuals that were covered by employer-sponsored healthcare. The orange is Medicare. The red is Medicaid. The yellow is individual coverage, and the white is those individuals who are not covered by any plan at all. As you see from this guide or this graph, that 48 million people were uninsured for various reasons back in 2009. And the reason why this slide is here, and I think it's important to look at, because certain politicians want to go back to 2009. They feel that Obamacare has been a great failure. If we just went back to what the healthcare looked like in 2009, then it would be a much better system. But as you can see from this, before Obamacare was passed, the ACA was passed, 48 million people were uninsured for one reason or another. And so this is the landscape that we may go back to depending on the discussion in Washington as we speak. So this is what the state was before Obamacare came in. So the goal of the Patient Protection and Affordable Care Act was to increase the number of Americans with health care. Healthcare costs was the #1 reason for bankruptcy. An ER visit on average would cost $1,265. One broken foot could be $16,000. Cancer treatment would average $30,000 per year. Some individuals couldn't afford health insurance. Others had jobs that didn't provide insurance. And some, and this is the same as today, chose not to buy insurance, especially anyone in their 20s and 30s. And some want to buy health insurance but couldn't under the old system because they had pre-existing conditions. I know a number of years ago, I couldn't get insurance. Nobody would insure me. So I have personal experience of that back in like 2000, in the early 2000s. Also, what they tried to do is lower the cost of healthcare per person on basis of cost controls. And then I have a link that discusses all these issues. So these are the goals. Some of the goals have been met, other goals have not been met. Healthcare continues to increase the cost of it. The structure of Obamacare, some people have likened it to a three-legged stool. One leg is individual mandate, where people were required to buy insurance or pay a fine. The other was guaranteed issue and community rating. In that situation, you weren't refused health care because of a health condition, and you weren't, and your premiums weren't based on your health condition. It was based on where you lived. So those with pre-existing conditions were guaranteed in coverage, and you weren't paying more for your insurance just because you had a pre-existing condition. And the third leg of that stool is that for those who couldn't afford, for those lower income people that couldn't afford health coverage, there were tax credits and subsidies to help individuals, and those were based on your income. So first of all, let's look at guaranteed issue. Carriers must sell to everyone regardless of medical condition. So there was no medical history, there was no health underwriting, nothing. And you weren't denied coverage because of pre-existing conditions. And again, I remember in the old days when you got individual insurance, you would have a very long medical history questionnaire to send out. All that is gone in the small plan market and the individual plan market. In addition to that, community rating, carriers cannot charge people with different rates for the same policy based on any other factors despite age, location, and smoking. Now, what's also very interesting is that if you looked at the community rating, under the old system before Obamacare, the difference between younger and older worker was 9-to-1. They reduced it down to 3-to-1. So older individuals got a break on their coverage, and the younger workers paid more. And that's part of the problem. The cost in this, that's part of the problem, that by doing that 3-to-1 ratio, it lowered the cost for older workers, but increased the cost, younger individuals, it added the cost. And then for the first time, and this was basically the first time the federal government got involved in this, qualified health plans, all plans sold to meet the ACA standards, had to include at least 60% of the average value. And they had to include 10 essential health benefits. So again, for the first time in the past, what could be included in individual or insurance policies were determined by the states. Some states had many mandates, others didn't have that many. But for the first time, the federal government got involved and said, okay, under the small group market and the individual market, your plans had to include at least these 10 items. And they had to be minimum values, so whatever you bought on the exchange, the value had to be at least 60%. The average cost of it covered at least 60% of medical expenses. You could buy up from that, but the minimum value was 60%. And again, this is something in the past that the federal government and only the states got involved in. So here on the exchange, there were all qualified health plans have to cover at least 60% of healthcare cost. And on the exchanges, the coverages were 4 mental levels: bronze, which is 60%, silver was 70%, gold was 80%, and platinum was 90%. Now, there was a catastrophic 50%, very low premiums, insanely high deductibles, only available if you're under 30. So to try to attract younger people, the catastrophic was there. I don't know how successful it was. But again, any coverages on the exchange had to look like these plans. And the second leg of this stool is the individual mandate. Individuals who didn't get coverage, and again, there was a question on your tax return whether you did or you didn't have coverage. The tax penalty was $695 or the greater of 2.5% of your household income, with a maximum of $2,085 on average. And the penalty was based on a month-by-month basis. So if some months you didn't have coverage, you weren't penalized the whole year. Now, there were some exceptions for various reasons. If you're an expat, hardship, domestic violence victim, or national disaster, and again, they will let you go for 2 months without coverage. Above that, you were charged a penalty. Now, this penalty increased over time. Now it's at the full strength right now. But again, this is one of the biggest complaints of Obamacare, is this individual mandate. People felt that it was un-American to have individuals be forced to buy health insurance. And so this was some court challenges. Supreme Court weighed on this, and this is something that the Republicans have vowed to do away with, the individual mandate. Now, to help individuals pay for this, there were tax credits, also known as subsidies. Two types were based on income and were based on relative to federal poverty line. There are advance premium credits, income between 100 to 400% of the federal poverty line. For individuals of between 12,000 and 48,000, and for family of four is between 24,000 and 98,000. As your income went up, the subsidies went down. So subsidies increase as benchmark premiums and deductibles increase, and subsidies would vary according to rating area. The average premium, for example, in Louisville, Kentucky was $229 a month, and the average premium in Anchorage, Alaska was $994 a month, so it varied on location. In addition to help with the premiums, there was also cost sharing reduction for certain individuals, income between 100 to 250 of the federal poverty line. So it's between 12,000 and 30,000 for individual, and $24,000 to $64,000 for a family of four. They would help you with deductibles, co-pays, co-insurance. So there were two types of assistance. One was on premiums and one was on cost of coverage. Now, the most controversial part of Obamacare, and where I think there was the greatest increase in coverage, was the expansion of Medicaid. And this is the biggest sticking point, and the reason why I bring it up, this is one area that there's been much criticism about the Republican proposals, because they were going to roll back this expansion of Medicaid. And this has been the big sticking point. You have to understand why they're having this problem. Under Obamacare, it expands Medicaid eligibility to everyone up to 138% of federal poverty line, which is $16,600 for individual, regardless of pre-ACA eligibility. 31 states, including DC, expanded. 19 states, all GOP health refused. There was a portion of Obamacare which the Supreme Court ruled on that 4 states to expand it, and these states fought it. Supreme Court ruled against the government, so 19 states didn't expand it. 2.6 million people are caught in the Medicaid gap, don't qualify for Medicaid, but earn too little to qualify for ACA tax credits. In October 2013, 57.4 million were enrolled in Medicaid. In October 2016, 74.4 million were enrolled in Medicaid. So there's an increase of 17 million. 13 million of that due to expansion, especially in New York, and 3.4 million people who were already eligible for Medicare, but either didn't know or were reluctant to join it until ACA, which was advertised. So again, this is the major expansion of Medicaid, and this is one area that all the Republican proposals would roll back this Medicaid expansion. This is the biggest sticking point where the Republicans, they wanted to basically give each state a choice of either expanding or not expanding it. And you'll see this in the next few minutes, where they will give a state a block grant, give them money, and then they decide what they're going to do. Now, other ACA provisions were very popular. There's no lifetime and annual lifetime limits. All plans, including group and individual, must meet certain minimum coverage requirements. Many meds that were popular, especially in small businesses years ago, were done away with. Young adults could stay on their parents' plan until age 26. Before, it depended on whether you were going to school or not. If you went to school, it was aged, I think, 23. If you didn't, it was age 19. And then on Medicaid Part D, there was a closes the donut hole that was part of the 2005 legislation, and more coverage was provided under Medicare Part D. So the landscape looks very different in 2017. As you can see, and look back at that slide in 2009, there was, as you can see, green is the employer coverage. Medicare is the orange. Medicaid expanded greatly, is the red. Individual coverage, which is the yellow, is exchange-based coverage, which was not in existence before. The gray is other non-group coverage. The blue is Medicaid and CHIP expansion. And again, still there's 27.2 million that are still not covered. So the landscape looks somewhat different than it did in 2009. Now, analyzing this, in 2016, the eligibility for ACA coverage among non-elderly uninsured people. If you look at this, on the right side is individuals eligible for financial care, 43%. Here, they could be eligible for all these different programs. Medicaid, other public assistance, tax credits, but they're not getting it. And on the other side, on the left side, those individuals that are ineligible for financial assistance due to income, eligibility for financial assistance, and ineligible for coverage due to immigration status. So there's various reasons according to this chart about why people are uninsured. So these are the pros of the Affordable Care Act. Lowers overall health care costs for providing insurance for millions, of making preventive care, which will reduce expensive ER visits, increases access to health care by expanding Medicaid. And the problem with Medicaid is you have coverage, but you may have, depending on where you live, you may not have actual coverage because many providers don't really take Medicaid because the reimbursement is so low. Increases the access to health care by disallowing exclusions for pre-existing conditions, keeping 26-year-old kids insured, limiting limits on coverage, mandating minimum coverage set, and providing exchanges with tax credits. It doesn't change the budget deficit, even though the number of governmental subsidized enrollees is increasing. It ties Medicaid doctor fees to quality measures, and mandates implementation of computerized patient records. So these are some of the pros that are in Obamacare. And again, the promise of decreasing, I think, healthcare has not been met because more and more individuals with pre-existing conditions have been in the system. That's why healthcare costs have increased. The second thing they have not done, which has increased costs, is they haven't lured that many other young people into the system to kind of have a bigger pool to decrease costs. Some of the conservative objections to Obamacare is it won't decrease costs. Healthcare costs are still increasing. If employers opt to pay the fine, governmental subsidies to cover it will soar. Increased taxes on high income that leads to fewer jobs, production, and savings. Huge expansion of governmental into private sector yielding less choice and freedom. There's some areas to the country that the exchanges may only have one provider. Individual mandates, a loss of freedom. Mandatory community rating will increase the uninsured by choice.
Larry. Sorry guys, I think Larry pulled his microphone out. Just a minute.
Can you hear me now?
Yep, we got you, Larry.
Okay, sorry about that. I must have touched. What I'm going through is the conservative objections. And cuts in Medicare, managed care will decrease choices of seniors and decrease efficiency. And even today, more than half the Americans want it repealed. So these are some of the conservatives' objections to Obamacare, and these have been trying to address in the appeal, but so far they have not been successful. Okay, legitimate problems with ACA. 19 states have not expanded Medicare, and again, these are Republican states in the South. Doctor and hospital reimbursements on Medicaid, and I've been explaining this, are too low, 40% of private rates. Feds cover 90-95% of the expansion. Again, the states are on the hook, and eventually that federal expansion money will go away in a few years. Group coverage, employer mandate ironically encourages job luck, which adds to the paperwork, costs, tracking employees. All of you understand some of the complexities of the employer mandate, especially the reporting requirements, determining who's full-time, and the requirement of covering those individuals 30 hours or more. Ineligible due to employer-sponsored insurance. In that situation, there is glitches in the fact that employees can opt out of coverage and then not get coverage at all. Also, in regard to the employer coverage, employers can get out of the $2,000 penalty by having essential health benefits that doesn't meet the 60% requirement. So again, some employers are providing less coverage than what was in place before. Also, risk corridor funding, there was a requirement under the law which the Republicans fought in a sense of paying insurance companies to provide coverage. That risk corridor funding has not been given to the insurance companies, and that's one of the reasons why insurance companies have been bailing on the exchanges. They have not been getting the payments that they were promised. Next, undocumented immigrants. This is again undocumented immigrants. ACA doesn't cover them, but hospitals still have to provide them coverage if they come to the emergency ward. Medicaid and CHIP eligibility outreach, obstruction by GOP officials, especially in the South, has not been expanded. A tax credit eligibility income, some of the credits are again too skimpy. Some of the eligibility and screening plans are not compliant. So again, and also there's a family glitch in if the spouse is offered coverage under the employer mandate, in that situation, then the whole family is not eligible for credits and subsidies. So again, there are many problems with Obamacare. Some because of the fact they had to get it through Congress, but again, because of that, still many people are not being covered. Amanda, are there any questions?
I don't have any at the moment. Just a reminder again that you can type any questions you have in the question box below and I'll read them aloud for you. If you have any questions about what we've discussed so far, otherwise, Larry, I think we're good to move on.
So the issue is, and everybody I kind of admits, even the Democrats admit, that Obamacare is not perfect and there's issues and problems. Some of the costs are too high. It has not attracted enough young people. The essential health benefits that are contained in the law contains items that many people don't want. So the question is, okay, when you do a repeal and replace, do you do a repeal and replace or you do a repeal and repair? So the first aspect of this was the bill that came out a few months ago, and the CBO estimated that the repeal of the ACA would increase the deficit by 145 billion between 2017 and 2025. The reason for that is because the fees and penalties that are associated with Obamacare would be gone. So if nothing else happened, if you repeal the penalties, the fees, there's a number of different things in Obamacare that funded all this, the exchanges. If that went away, again, there would be a deficit of $145 billion. Also, believe it or not, as talked increase about repealing Obamacare, all of a sudden Obamacare became more favorable. So as this question, and this is from the Kaiser Family Foundation in October, the questioner was asked, given what you know about the healthcare law, do you have a general favorable or generally unfavorable position? And it was 45 for and 45 against, with 10% had no opinion. So the reasons for unfavorable opinion include concerns about the cost of coverage and perception that the law gives the government too big of a role. And again, because of the fact that this is 16% of the economy, people were concerned when the federal government got involved. But again, after all these years, as time went on, Obamacare got more and more popular. So as Congress looks at the reform and to replace the ACA, policymakers may wish to avoid adverse consequences, such as coverage lost to 20 million people, that's through the exchanges and also through Medicaid, reform to an era of pre-existing conditions, and that's the big sticking point, because if you look at the discussion about the various proposals in this first round and the second round, one thing that people are dealing with is pre-existing conditions, and some politicians on both sides want changes to the pre-existing condition exclusions. They want to reimpose pre-existing conditions in some form or fashion. Also, how to deal with the deficit increases stemming from the repeal of ACA revenue generated provisions. Like I said, there's a number of fees and penalties that fund Obamacare. And really nobody is addressed, and the issue is the continued premium increases in the individual market. Some of the increases are 20 or 30% a year. How do you deal with that? And nobody has come up with an answer how to decrease the cost of insurance. So in the first go-around in Obamacare, it defunded Planned Parenthood, $153 million per year, 40% of the total budget, defunds Medicaid expansion starting in 2020. This is part of the Ryan's Healthcare Act. Defunds cost-sharing reductions completely starting in 2020. That means the subsidies would go away in 2020. Changes non-ACA Medicaid to block grants, kicks people off more later. Changes tax credits from income-based to age-based. $2,000 for younger workers, $4,000 for older workers. And tax credits no longer increase to match premium hikes, nor do they vary with geographic or rating areas. So again, the fear was, as part of this first go-around with Speaker Ryan, Many of these caused alarm because of the fact that, one, many people would be kicked off Obamacare. Two, Medicaid would be, again, decreased by 2020. And also the Republicans didn't like it because many aspects of Obamacare would stay in place till 2020. The employer mandate, the individual mandates, the credits and subsidies would stay in place to 2020, and then everything would then, people would be kicked off then. So Democrats didn't like it because they didn't like what was happening in 2020. Republicans didn't like it because Obamacare would stick around for another 3 or 4 years. Other parts of the proposal that came out is that changes age band from 3 to 1 to 5 to 1. Older employees can now be charged up to 5 times as younger workers. Eliminates the minimum 60% average value, bronze. And then what would happen is if they reinstituted pre-existing conditions, of $100 billion over 9 years would be provided to states for high-risk pools. So the theory is in this, and this is to look at any new proposals, the individuals with pre-existing conditions would be segregated into high-risk pools, and then insurance companies would then be given money to finance those high-risk pools. So yes, you'd be provided coverage, but again, it depended on what state you're in and what kind of subsidy you would get in these high-risk pools. Anybody who didn't have coverage, and then later got coverage could be charged a penalty up to 30% of 1-year premium. And one of the complaints of Obamacare was that at any time you needed insurance, you could jump on insurance and drop off. So to discourage that type of behavior, if you had a lapse of 6 months or more, then if you got coverage again, the insurance company could charge you a penalty of up to 30% of the 1-year premium. Also what it does, it wipes out over half the revenue to fund ACA, including the 3.8% investment tax on rich people and the 0.9% Medicare payroll tax. And again, it doesn't replace those differences with anything else. So that was part of the first proposal that was, again, a few months ago, that was the Republicans didn't put up for a vote. Also would give the top 1% a 33% tax rate, tax cut because of the fact of the decreases in the Medicare and other taxes. $197,000 tax cut, and the top 400 richest Americans would have an average tax cut of $7 million. Repeal the ACA standards for health plans and premiums and subsidies until 2020. It retains all the private market rules, essential health benefits, retains health insurance marketplaces, encourage use of health savings accounts, would eliminate the individual mandate effective January 1st, 2016, and it will eliminate the employer mandate penalty reduced to 0 effective January 1st, 2016. Again, this was part of the first proposal. Now, what killed the tax bill, what killed this ACA repeal bill, was the CBO came out with a score. And what the CBO indicated was there was 14 million would lose coverage in 2016. Another 10 million would lose it by 2026. Just about all losing coverage would be low income, Medicaid and elderly. By 2026, total uninsured would be 52 million. Age-based tax credits would actually be somewhat better for some in the middle class, but devastating for low-income individuals. Premiums would increase by an additional 15 to 20% per year through to 2020, and would then gradually decrease up to 10% lower than the current projections. And deductibles would increase even more in two ways: lower average value requirements, and the assistance would be cut for lower income individuals. So again, all this kind of led to everybody running away from the bill. So again, as you can see from this, most Democrats and many Republicans couldn't support this bill because, again, the problem with it is it blew a hole in the deficit. It threw too many people off health care. And so now we're having a second round of health care reform discussion. Amanda, do we have any comments or questions?
Nope, none at the moment. We're ready to move on.
Okay. So let's put the crystal ball in place, and let's see what's going to be happening over the next few weeks and months. Because right now we should know in the next 2 or 3 days whether the Republicans will have the second try at trying to repeal and replace or repair Obamacare. So here are some of the suggestions how to fix ACA problems. Instead of repealing Obamacare, how about we just fix the problems? Let's fix the family glitch. Other family members could qualify for tax credits just because someone in the family was offered health coverage. Fix the skinny plan glitch. Again, small employers, or one way to get out of the $2,000 mandate, you could do a skinny plan, which is basically a glorified wellness program. Require an employer-sponsored policies to be at least bronze. And again, that's not part of the employer mandate, the $2,000. Restore risk corridor funding. That would, again, encourage more and more insurance companies to go into the exchanges and provide more coverage. Guarantee repayments. House brought lawsuit. This is the risk corridor payments. That's why many insurance companies are leaving the exchanges, because they weren't given the promised payments. Restore those, and I think more of the exchanges would, again, be healthy. Require all individual mandate plans to be offered by the exchanges, better yet, exclusively on the exchange. Beef up individual mandate penalty. That's going to be unlikely because I think that's unconstitutional. And beef up the tax credits. That's not going to happen either. Now, what the conservatives have done is they've come forth with reforms in healthcare. Give everyone individual tax credit relief, regardless of where they work, and purchase their own insurance. So give people tax credits to purchase their own insurance. Replace the tax deduction for employer contributions with a tax credit for individual purchase. One thing that many conservatives are supporting is no barrier to interstate insurance rules. So if you wanted to, and you could buy a insurance policy from other states, and again, the states are fighting this tooth and nail because many states, especially in the North and Northeast, have many mandates, while states in the South don't have that many mandates. So again, you're going to see pushback from many of the states in regard to that. Allow employers to convert from a defined benefit to defined contribution plans. Instead of requiring employers to provide coverage, why don't we encourage employers to give employees a certain amount? They could then purchase their own coverage on the exchanges. Move Medicare to a defined contribution plan. Allow Medicare plans to opt out of Medicaid and get their own coverage. Promote new group purchasing based on organization memberships and associations. Right now, many states limit what people can do. What the Republicans want to do is encourage small business to get together and form purchasing pools where they could actually share the risk. Right now, that's a MIWA, and many states have barriers against that. Do more consumer directed options like health savings accounts and flex plans. The problem with that, especially, that won't work unless the employers provide contributions to that, because in some industries and some employers, the employees earn so little they can't contribute any extra money to any type of plan. Extend rational pre-existing condition protections to individual plans, rewarding responsible behavior. And the problem in this area is where you draw the line, especially if you have you have family history of certain, and no matter what you do, you have chronic conditions. So when you say responsible behavior, what does that mean? Provide equal payment for traditional Medicare and Medicare managed care programs. Encourage states to set up high-risk pools and consumer-based reforms. And what they want to do is segregate those with pre-existing conditions and then give them subsidies to buy insurance, but don't affect the rest of the population. Provide Medicaid insurees with opt-out to private insurance. The problem is, how much are those payments? Is it going to be meaningful enough that people can buy actual coverage? Increase fraud and abuse efforts on Medicaid. Encourage private savings and private long-term care insurance, and stop new tax increases and promote tax cuts to expand private insurance. Other new Republican proposals: states could apply for federal waivers from several coverage requirements as part of the new proposal. The states could design their own programs for coverage. Waivers from the Affordable Care Act provision that obligates insurers to cover essential health benefits. That's going to be key. Circle that. That's extremely important, because that's one of the drivers of coverage increases, because of the 10 essential health benefits. Those include mental health, maternity, and substance abuse services. And again, provide states with an opportunity to offer coverages without that. And the current version of the GOP legislation would erase that coverage requirement, but would let states reimpose it on their own. So if a state wanted to have those 10 essential health benefits, fine. If you don't, the state would have that option. Let states seek an exemption to the law's requirement that insurers must offer coverage to people with serious diseases. And again, the newest proposal is put those individuals and segregate them in a high-risk pool. Patients with high-cost conditions such as cancer and AIDS would not be segregated in a separate insurance pool, but the insurers would receive extra payments as the government would cover the share of claims exceeding the levels specified in the federal officials. So again, there's various proposals to provide coverage and not affect the rest of the population. Other people are suggesting if the Congress can't get their act together and pass something, there's other administrative actions such as stop cost-sharing subsidies. The ACA provides financial assistance. House Republicans have challenged the constitutionality of aid payments to insurance companies because many of the guidance in regard to essential health benefits is through regulation. One thing that's been suggested is tweak the insurance benefits. The ACA requires insurers to come up with 10 different categories of essential benefits. And again, in that situation, eventually what the administration could do is propose regulations that would ease some of the requirements of those essential health benefits. So again, this is something that could be done without congressional action. Also, other things the administration can do is remake Medicaid. Alongside subsidized private insurance for people who don't have job coverage, the ACA expanded the Medicaid to serve millions. With the repeal effort stalled, some 19 states that have refused the expansion may come forward. That gives the Trump administration an opportunity to steer an important program in a different direction, maybe come up with a different solution for those states to solve the Medicaid problem. And again, the problem with Medicaid in this situation is, yes, people have coverage, but they may not have access. And again, in certain areas of the country, Medicaid doesn't work. Also, what the administration could do is wink at insurance penalties, say, yes, the individual employer mandates are on the book, but again, we're going to ease enforcement on the individual and on the employer mandate. So again, they could say, even though it's on the book, we're going to choose to give individuals that don't have coverage a buy in any insurance penalty. So that could happen if for some reason Congress does not repeal Obamacare. So the $64,000 question is, what's going to happen to the employer mandate, the individual mandate reporting and non-discrimination rules? Depending on what happens over the next few weeks, we may still have the employer mandate in 2017, 18, and 19. Same thing with the individual mandate. Individual mandate will stay in place in 2016 and 17, and we don't know whether it's going to survive in 2018. Definitely the employer, the reporting requirement, the 1094 and 1095 will stay in place in 2017, but the $64,000 question is it going to be in place in 2018? We should know in the next few weeks. Of any requirement under Obamacare, that was probably the most onerous and the most complicated. And many employers spend thousands of dollars complying with the reporting requirement. And it may stick around for it will stick around for 2017, but the question is, will it stick around for 2018? As part of Obamacare, there was non-discrimination rules. IRS has never released any guidance on that. They were supposed to be in place in 2011. It's never been. And these non-discrimination rules are supposed to be in place for insured plans. I think realistically those requirements are gone. Also, there's been no support for the Cadillac tax. Now, that Cadillac tax has been delayed to 2020. I think that's going to be gone relatively quickly. And there's been no support either on the governmental side or the union side, so I think that's going to be gone. Essential health benefits, I think that will be eventually changed and modified in some way, because that's one of the drivers of healthcare cost is essential health benefits. So you're going to see changes both on the individual market and the small plan market. Pre-existing conditions, I think realistically there would be, right now there's no pre-existing condition. I think eventually there's going to be some return of pre-existing conditions. So, realistically, I think you're going to see some return of pre-existing conditions. Expansion of Medicare, Medicaid, I think that will go away. They're trying to figure out what some way to, again, ease the burden of those that will lose coverage. So we should know that in the next few weeks what they're going to do. Dependent coverage to age 26, that will stay. Marketplaces, the state marketplaces will probably stick around because that's a good way to sell insurance. There's been no mention of the full-time employee definition. I think if the employer mandate goes away, that will go away. I think the health FSA limitation will be done away with. Now it's $2,600 that will be done away with. And especially, I think you're going to see freestanding HRAs where you don't have to sponsor a health care coverage will probably come back. So those will come back. Other changes, the DOL had proposed expanding the Form 5500 reporting. That's gone. I think you're going to see changes in wellness rules right now between the EEOC and IRS and CMS. It's very complicated. I think those are going to be simplified. Contraceptive coverage, I think requiring an employer to offer that is going to be gone. Same thing with gender transition services, that's going to be gone. Individual to income tax, I think eventually they're going to allow individuals to deduct their individual premiums. In order to take care of that, some deductions will be limited or eliminated. and some credits will be eliminated in order to broaden the tax base. I think these are changes you're going to see. Other possible changes in worker protections, the overtime rules will go away. There's going to be slow increases in minimum wage. There's not going to be any further legislation in pay equity or equal employment opportunities. Any paid leave, I think, is going to be left to the states and local. Many states and many local municipalities are passing these. And there's going to be a lesson of enforcement of independent contractors. And because the Obama administration was really enforcing that, I think you're going to see the Trump administration not enforcing that. So again, employer-sponsored healthcare mandates will stay in place in 2017, possibly in 2018. Reporting will stay in place in 2016, but I think it'll stay in place in 2017, maybe not 2018. And under the new system, HSAs and HRAs would be favored. In regard to retirement income reporting and fiduciary role will change. Your limits on your 401k and your pensions will probably stay in place. And because of the reduction of individual limits, I think Roth 401k and IRAs would be less favored. Amanda, are there any questions?
Yes, just 1 minute. Any idea how many people are covered under a skinny plan or MEC?
No, I haven't seen any statistics in regard to that.
And another person wondered if you could speak to the concept of a company utilizing the self-insured loophole.
Well, we're talking about the MEC plans, and in that situation, people are getting around the $2,000 limit by putting an MEC plan, which was self-insured, and therefore got away with the individual mandate. So far, I've not seen anything that does away with that. So I think that loophole will probably stay in place. So I have not seen anything that actually increases the requirement for employers to offer more coverage. I think those who have MEC plans now, if the employer mandate goes away eventually, I think those employers will do away with, and I think what the next step is going to be is encourage employers, instead of giving an MEC plan, encourage employers to give people money to go to the individual markets. I think that for small business, that's where the emphasis is going to be. Just give people X amount per year to buy individual coverage, and then the employer doesn't have to worry about anything anymore. I think that's what the encouragement is going to be.
Alrighty, and those are the two questions we had at the moment. If you have any other questions, please feel free to leave them in the question box below. Otherwise, thank you guys so much for joining us today. Again, our next webinar will be in 2 weeks on the 16th, and we'll be covering Medicare for employers. Have a great day.
Take care. Bye-bye.